In treating patients who have suffered acute infarction, the goal is to restore the flow of blood in the coronary artery that caused the infarction in order to obtain an optimal and effective myocardial reperfusion. The Amicath device facilitates reperfusion in acute myocardial infarction and helps to decide the appropriate strategy during primary angioplasty. The Amicath is a simple, quick-to-use and highly useful device for rechanneling the artery, delivering drugs locally, and determining the need for thrombus aspiration. The aspiration is carried out by means of the Hunter device without requiring any replacement of the guide. The conical shape of the Amicath, which widens from 0.017 inches to 1.5 millimeters, makes it possible to rechannel the artery by means of the Dotter effect and reduce the risk of distal embolism. The presence of 4 radiopaque markers, set at 10 mm intervals, makes it possible to calculate the length of the lesion to be treated and select the appropriate stent. This makes it far easier to perform direct stenting, avoiding predilation with a balloon catheter and the risk of distal embolism. There are high flow holes between the 3rd and 4th radiopaque markers, enabling local injection of drugs or iodinated contrast in order to observe the condition of the distal vessel. Proximal contrast media can also be injected simultaneously by means of a guiding catheter, distally to the lesion, enabling the lesion's characteristics to be observed. Thanks to the quick exchange design, the catheter can be moved simply and quickly. The use of the Amicath is indicated in cases of primary angioplasty when the flow of the responsible artery is TIMI 0 to 1. After the guide passes the occlusion, the catheter is inserted past the 4th radiopaque marker. This makes it possible to rechannel the artery by means of the Dotter effect thanks to the conical shape of the Amicath, providing access to circulation distal to the occlusion through the perfusion holes. The contrast medium is then injected through the distal holes to view the distal vessel. Simultaneous injection through the guiding catheter makes it possible to view the length of the lesion. As the Amicath continues through the occlusion, anti-aggregants and other drugs can be injected locally through the distal holes, reaching the distal microcirculation and reducing the risk of lesion by reperfusion. When the Amicath is removed, the artery is rechanneled to TIMI 2 to 3 by means of the Dotter effect, enabling the characteristics of the lesion to be viewed and the need for aspiration to be determined. The size of the stent to be implanted can be determined thanks to the catheter's radiopaque markers and viewing of the vessel. The preparation of the artery with the Amicath allows direct stenting to be performed without predilation with a balloon catheter and the risk of distal embolism. It also makes it possible to determine the need for thrombus aspiration prior to implanting the stent. The total duration of the procedure is very short. In the absence of a thrombectomy, it takes no longer than 5 minutes.